Hi everyone, my name is David. I'm a junior at USC here studying computer engineering, computer science, and minoring in physics. I have attention deficit hyperactive disorder, and it's always affected the way that I live, the way that I view the world. I'm from Bellevue, Washington, which is very close to where Microsoft is headquartered. But I've lived all around the U.S. I moved around a lot growing up.
Yeah. So when did you get diagnosed with ADHD? When did you start kind of noticing things were a little bit different, and your parents maybe noticed?
So I was diagnosed with ADHD in 7th grade. I had suspicions I've had it since probably I was in somewhere between the 1st and 4th grade, because my older sister was diagnosed much sooner than I was. Both of my siblings have it, as well as my dad. It's pretty mind-blowing. But I long had a difficulty paying attention, focusing, concentrating, sitting still. That one has gone away now I'm 20. I don't run around as much as when I was 10. But attention, focus is still a difficult issue for me. However, it was a lot of what led me to be diagnosed in 7th grade was acting out in class, distracting others in class, and kind of just behaving badly, in part because I couldn't focus, in part because I was having trouble socially, in part because I wasn't challenged, just different factors. When I was in elementary school, I was always getting good grades because I learned quickly and didn't need to focus a lot on homework, although I would still forget to do it. In middle school, we started having more rigor, if you will, more difficult coursework, more difficult advanced topics we had to learn. And when I would just not do my English homework, it mattered more. When I bothered the kid next to me when we were learning about usually a subject they didn't care about, I was going to use like space as an example, but I definitely was paying attention when we were learning about Mars or something. But a lot of it was misbehavior, a lot of it was focus, but that was something that I had trouble with my entire life and continue to this day, and my medication really helps me with that. That's one thing about ADHD, though. It's much easier for me to focus on something that I care about. It's much easier personally for me to, for example, work on math or physics homework or programming after my medication wears off. I'll still be less productive than on my medication, but if I try to write an essay at like 11 at night after my meds wore off at like 8, it will be very difficult. I'll have to disconnect from the internet, everything will distract me. So it was a combination of those things that led to my diagnosis. The thing impressed me.
Yeah, so you want to tell people kind of about a little bit more about the medication side of things.
Sure.
Like, when did you start taking medication for the ADHD? And so you said that it's helped a lot.
Oh, it's helped me enormously. It's very hard for me to do work when I'm off my medication. So let me walk you through a day without my medication. I wake up, I want to stay in bed for like an hour. And I'm sure that's relatable to a lot of people. I want to stay in bed for half an hour even if I'm going to take my meds. I mean, I take my meds after I get out of bed normally, but if for some reason I don't take them soon, I will be very procrastinatory in the morning. Let's say I go to class forgetting to take my meds, and I forget my meds at home. I always bring them with me just in case. But if I didn't, my day would go something like this. I show up to my first class, I pull out my phone, I start taking a lot of Snapchat selfies and just like messaging my friends on Facebook. And then if I decide to try to take notes, and I manage to be non-distracted enough to do that, I'll notice my handwriting is awful. For whatever reason, my meds help my handwriting go from terrible to almost legible. True story.
Oh.
Yeah, my handwriting's awful off my meds. It's very hard for me to focus, and the meds really help me accomplish learning tasks better, and even more than that, productive work tasks. They somewhat inhibit my mind wandering, it has its ups and downs. Like, maybe I have more out-of-the-box ideas when I'm off my meds. My mind is just everywhere at once, but that's a problem when you need to be writing an essay or when you need to be finishing a program assignment or something.
Yeah, absolutely. So what have you kind of seen people think of you as a person with ADHD, a person that takes medication for ADHD? Is this something that most people know about you, your friends know?
I'm very open about it. Most people that I'm close to know that. Many people I'm not close to probably know that. Sometimes it becomes an issue when I have to ask somebody to be a little bit more patient with me later at night, or to like remind me I need to be focusing. After my medication wear off, sometimes people think that I don't have much of a filter, and there's some truth to that. Even when I'm on my meds, I'm willing to speak my mind more than a lot of people, I think. But realize I might be less diplomatic about that, and that's something I've been working on for a long time. And I've made a lot of progress since I was 12. So edgy little 12-year-old. But I'm much more refined now, let's say. But it's sometimes it's I don't think people like write me off for having ADHD as much as some people are dismissive to ADHD as a thing that isn't. Some people seem to believe that it's made up or it's not that big of a deal. They obviously haven't met me when I was off my meds because I get very scatterbrained, unproductive. I'm an intelligent person, but when I'm off my medication, I can get distracted very easily. It can become very hard for me to work. But sometimes people are like, I think we all have a little bit of it, and depending on what context you're saying it, people don't like mean to offend or mean to insult, but like, I have trouble getting distracted too. But one of my friends who told me that, who will remain completely anonymous, told me that this, like a week after she told me one time she took Adderall to try to study, and instead of studying, she cleaned her room and she couldn't sit still, which is definitely a sign that she does not have ADHD. For me, Adderall or other medication that I've been on are the reason I can write an essay, not the reason I'm going to clean my room instead of writing an essay. So it's more than people like judge or treat me different for having it, or when I reveal that, that people seem to think it isn't something that can strongly affect me, or it's something I can just get over easily, or it's something that everybody has to a different extent. Now, some people legitimately do have ADHD. I think my roommate might have it, and he isn't diagnosed. But it's definitely not a one-size-fits-all kind of thing. But I'm more affected by people having a dismissive attitude than to the disease itself than to me as a person with it.
Mm-hmm. So does it frustrate you when you see people say something like, everyone has a little bit of ADHD, everyone's a little bit,
It's more, depending on who, sometimes a bit frustrating, sometimes a bit disappointment, sometimes I just get used to it.
Mm-hmm.
But when somebody that I care about says something that seems to dismiss something along the lines of, get over it, I get over it when I'm distracted, when I'm studying, where it's clearly someone that does not have attention deficit hyperactive disorder, it can be a little bit upsetting, it can be a little bit hurtful.
This is like this significant thing that you have to deal with on a daily basis, and they're discounting it.
Yeah, exactly. Like, it could be the same person I'm studying with at like 3 o'clock p.m. and they're like, wow, you're doing a great job. And then at 9 o'clock p.m., if we're still together or we left and met up again, and I'm not getting a lot done, and I have to explain it's because my meds have worn off and my booster meds have worn off.
Mm-hmm.
It's something that affects me very strongly. And I like having ADHD, but it's something that I'm very grateful I have the medication to help me with when I need to be productive.
Mm-hmm.
It sort of frames my day in a way, because I know in college a lot of us are very hardworking, are very stressed, are very busy. My roommate stays up until probably 2 a.m. almost every night doing homework. For me, I'm fine going to sleep at midnight unless I like really, really need to do something urgently, because I know after, say, 8 p.m. my meds are worn off. After 10 p.m. it's very hard for me to get productive work done, especially in a subject I care less about. I think I mentioned that a bit earlier.
Mm-hmm. If
it's math problems for me, or if it's physics, or if it's programming, I can still make incremental progress, not quite as quickly. But if it's an essay, unless it is due the next morning, in which case I'm going to drink coffee and do it. But if it's an essay due in 4 days, I'm fine to go to sleep, because I know that I've reached the threshold point of where it's more productive for me to get a restful night of sleep, wake up in the morning, take my medication, and continue. And a lot of people who I think are sleep deprived don't do that. I think we all have that threshold point of our night, but a lot of people are more willing to hurt their sleep hygiene. And for me, I realize, okay, I'm done being productive. I'm not going to try. I'm going to relax. I'm going to go to sleep soon. So it has its ups and downs.
Oh, yeah. So it sounds like medication has really helped you, like almost.
Yes.
So, kind of switching gears a little bit, something that we're hearing more and more about is people abusing Adderall or different ADHD treating medication stimulants.
Mm-hmm.
whether it be amphetamines or methylphenidates or whatever it be, abusing that to enhance academic scholastic performance.
Yeah.
So what is your opinion on that? Have you seen anyone asking you for
in high school nobody had ever asked me to sell my medication. In college it happened on several occasions. I'm trying to count the number. But while I'm doing that, let me preface with, as much as I appreciate how my medication has helped me, I would not willingly choose to take it if I didn't need it, because it does have side effects that I don't like. My medication suppresses my appetite and my ability to sleep more than it helps treat my ADHD symptoms. And even more annoyingly than the fact that it does those things stronger, it does them for a longer duration. So even if my booster meds wear off at 4 p.m., the inability to take a nap lasts until maybe 8 p.m. If I take my medication late on a given day and also take my booster, it'll be very hard for me to fall asleep, because it's similar to caffeine or even cocaine or amphetamine or other stimulants in the way that it causes your body to suppress its ability to sleep. The ADHD meds make you very thirsty. They all give you dry mouth. Some of them even also, at the same time, very annoyingly, also make it harder to drink water. Do you know what it's like to be thirsty all the time and also it's difficult to force yourself to drink water? I'm feeling that right now. When I was on Adderall, it was easier to drink water than when I'm on Concerta, which I currently am. I've taken throughout my time being diagnosed Concerta, Ritalin, Vyvanse, Adderall, and now back to Concerta. And those aren't counting the booster medications, which are usually the same chemical, but on a short or immediate action instead of extended release mechanism. Concerta, which chemical is also methylphenidate.
Right. Yeah. So
I guess to answer the question that you asked, let's see, probably 3, 4, 5 times freshman year, up to 8 times sophomore year, and several in passing this year in my junior year. People have tried to have offered or asked me to sell them, offered to buy from me or asked me to sell them. Even once or twice asked me to work with them to sell medication, like for profit. Once or twice to sell to somebody's friend. Please, he's poor, he can't afford it, or whatever. And like, when somebody's offering you $15 a pill for a pill that you get insurance for, it's pretty alarming. Especially when in high school I was never exposed to that. I wasn't exposed to that until 3/4 of the way through my freshman year of college. It's pretty alarming, and people want to use that to take advantage of their studies, but keep in mind, it doesn't affect people with ADHD the same way it affects people without ADHD. Like my friend who will remain nameless, who abused Adderall to try to study and told me that they ended up cleaning their room and couldn't sleep all night, which actually the ability to not sleep all night is similar in how it affects people with ADHD as well. I want to clarify that, and that's one reason if I didn't have to take it, I wouldn't. In fact, on weekends, I take 3/4 the dose I normally take on a weekday because I don't want the side effects to be as strong if I don't need to get as much work done. And a lot of the time on weekends I won't take my booster medication either because I just don't need it. So when people have, and in addition to people trying to buy from me or get me to sell, first of all, I think that the price that they would want per pill is less than what insurance pays for it. Fortunately, I have insurance, but I believe that those are very expensive medication for the insurance for if you didn't have insurance, if you had to buy it on your own. And it's pretty alarming to me that people want to take advantage of this thing, and I think it's definitely a growing market. In passing, I've seen people who, sometimes people who I think might have been inquiring about whether I was willing to sell indirectly, but also sometimes people just bring it up, oh yeah, I took an Adderall at Coachella, which is really alarming to me because, among other things, I believe this person had been mixing it with alcohol, which is very bad for your liver. When I like specifically mark that I don't want to go out for a given night, I'll take my booster because it's very bad for your liver to mix Adderall as a stimulant or other ADHD medications with alcohol. And I hear that somebody has mixed some ADHD medication with alcohol, which is awful for you. That just kind of alarms me.
I'd actually heard that from another person that I talked to, that it is a small trend for people to take Adderall before they drink, so that they can actually get drunk on less alcohol. So people are consciously doing that, at least anecdotally. And yeah, just obviously.
I believe I've heard that when you take a stimulant and you take a depressant, they kind of enhance each other's effect or something.
Mm-hmm. Yeah, well, and it's just very dangerous to be mixing substances like that, obviously, and also taking a medication that you don't need when you're not prescribed it. And I imagine that can be a very frustrating thing for you to need this medication. It's helping you to live, a normal life, to help you function a little bit better. And people are trying to abuse it. For
I don't take medication to get straight A's. I take medication so I can work like a normal person works, so that I can write the essay. It's not so I get an A+ on the essay. The essay, like, I care about my engineering class, I care about my math classes, I care about my writing classes too, but I won't be heartbroken if I get like a B+ in writing for 40, for example.
Mm-hmm.
Whereas I'm working hard to get an A in all my engineering classes, but without my medication, I would possibly fail, probably not fail, but not do much worse in the classes that aren't that I don't see as relevant to my future or to my skill sets or interests. And I sound bad saying that, but it is what I've observed of myself. And for me, when people are trying to use the medications to get ahead, first of all, unethical. Second of all, probably depriving somebody of medication they need, or at least needed at some point, and harming their body and even more alarming than using it to try to take advantage or get an advantage is using it recreationally. Another side effect I didn't mention is it makes me laugh a lot less. Now, I will crack up from almost anything when I'm off my meds, and I like that. I enjoy laughing. I enjoy making people laugh, but it makes me a lot more serious. So for me to hear Adderall or Concerta or something as a recreational drug is like out of the blue. It's like, for me, it's the opposite of having fun. It reduces the amount of fun that I have, and people use it recreationally, which is terrible for them, but also for me as someone with ADHD, it seems to have the opposite effect of recreation.
I really appreciate your input. I think that was really helpful. Getting to know someone that actually uses this medication to treat their ADHD that can be debilitating, right?
Yeah, you should see one time last year. Fortunately, it was over spring break. I ran out of medication, and I was just a wreck when I was in Amsterdam for a couple of days. Fortunately, I didn't have to get anything done, but like, it can be very debilitating not to have my medication. So that's why I carry it with me everywhere. It's always in my backpack for like the pill container that has it for about a week or so. Wherever I am, I can always pop my booster at 4 p.m. or whenever I need it. Because my main medication lasts 8 hours, my booster lasts about 4. It's 12 hours, it's say 8 to 8 of me being productive, and the rest of that is when I'm sleeping or something. But I really hope that people be mindful of people who have ADHD or ADD, that people don't abuse medication for many different reasons. Ethical in terms of how fair it is to other people, ethical in terms of harming their body, and dismissiveness towards the disease, towards the condition in general. So thank you for interviewing me, Dan.
Yeah, really appreciate it, David.
I appreciate it too.